Now, using the RAS approach, this is a plain chest radiograph of an anonymised patient. It is a PA film and the right side of the patient is clearly marked. Now for the adequacy of the film. This film is adequate. I say this because both the apices and the bases of the lungs, right up to the costophrenic angles, can be seen on both sides. The patient is well positioned and there is good inspiratory effort. The film is well penetrated. I say this because I can see the spinous processes of the vertebrae behind the mediastinum. Now for a systematic approach. Looking at the airways first, the trachea can be difficult to see, however, it is central. The main bronchi are also quite difficult to see. Looking at the lungs, throughout all regions of the lungs, on both sides, there is this fine linear opacification. It is most prominent in the midzones on both lungs. Some would describe this as a patchy opacification on both sides. The costophrenic angles can still be seen on both sides. However, the cardiac shadow can be difficult to make out, particularly down here near the diaphragm. The right side of the heart can be especially difficult to delineate because of this patchy opacification. I see no clear soft tissue abnormalities and no clear bony abnormalities. Now for extra marks on this radiograph, I note a rather dense opacification in the shape of a key. This key-shaped object may well have been in the patient's pocket at the time of the radiograph. Now, in terms of the most striking abnormality, I think it's fair to say in this radiograph the most striking abnormality is the fine linear opacification throughout all regions of both lungs. This patchy opacification is partially obscuring the borders of the heart and can be seen throughout all regions. So in summary, this is a plain chest radiograph of an anonymised patient which shows patchy linear opacification throughout all regions of the lungs. This would most likely be consistent with pulmonary edema, which is a consequence of heart failure.